Now, there has been a rise in swine flu cases across India this winter season. In less than a month this year, the highly contagious virus has infected as many as 4,500 people and also claimed 160 lives, according to the Integrated Disease Surveillance Program. And Rajasthan is where the impact is being felt the most, followed by Gujarat, and even the national capital this time is grappling with this issue. With the numbers going up, the Health Ministry recently held a review meeting with various different states and asked them to strengthen surveillance. That is very key. I have Dr. Rahul Sharma, who is the Senior Consultant of Pulmonary and Critical Care in Metro Hospital. Thank you very much for joining us to talk about this. Who are the people who are at risk? That's what we want to highlight. Apparently, swine flu, the symptoms are the same as a normal cold. When will a person know that he has to go and see a doctor? This is serious.
Yeah, so the guidelines has been given by the Government of India that you categorize your patient on the basis of symptoms and the risk factor into 3 categories, category A, B and C. Category A are the patients who are normal, healthy people and they just feel simple cold. They have cold, cough, sore throat, and there is mild headache or mild body ache, but nothing else, and they can be safely stay at home. People who are at risk are people who are less than 5 years of age, more than 65 years of age, or patient who has any kind of chronic illness in terms of lung disease, heart disease, kidney disease, neurological problems, or patient who are immunocompromised. These are the people who are at risk, and if they have symptoms and they are severe enough, like severe headache, high grade fever, throat pain, they are not able to take anything, drowsiness, then these are the people who need immediate attention of the medical doctor. And if the symptoms are severe enough that people feel breathlessness, people are not able to speak, people have hypotension, bluish coloration of the nail, then these are the patients who need medical emergency and should be hospitalized immediately. So this is the category which has been given clearly by the Government of India, and if we should follow these categories, we can easily identify which patient needs medical attention immediately or which patient can be safely stay at home and take all the precaution to prevent further infection.
Are you seeing an increase in patients
Definitely,
this year?
Definitely. There is a huge increase in the cases of H1N1 in the last 1 month or so. When the cold is severe, then these cases are on a rise at our hospital also.
Okay, and what do you suggest the patients can do to prevent themselves, or those kind of precautions that they can take?
That is very important, that you should take precautions, because prevention is always better than cure. So the most important precaution that you can take is cough hygiene, because this virus spread through your cough, your nasal secretion, contaminated your hand and the objects, and can stay on different objects for up to 24 hours. So you should take all the cough hygiene measures. You should take proper precautions in terms of that. If you feel sick, you should stay home, should not go into the crowded places, so that you can prevent further spread of this infection. If you are at high risk, you should again stop going into the crowded places, stay at home. You should use mask which is N95 or above, because this is the mask which gives protection against H1N1 virus, not the normal mask. You should take proper hygiene. Vaccination is again very important, and it has been emphasized again and again in various platforms that all the patients who are at risk, people who are less than 5 years of age, more than 65, chronic medical condition, should take this vaccination on an annual basis. Although CDC has given this, that everyone should take this vaccine on an annual basis, but we can always prioritize our patients and prioritize our public.
Just tell us briefly a bit about vaccination. Is there a time period before winter sets in that you have to take it, or people can take it at any point of time?
So this vaccine, every time Government of India produce new vaccine, because every time this virus may change. So every time there is a new strain for the vaccine, and this vaccine usually takes up to 3 weeks to give its proper immunity to the patient. Okay. So generally it is recommended that whenever new vaccine come in the market, that is usually September and October, you should take these vaccination, and by the time winter comes, you are properly immune to this kind of infection by this vaccine.
What makes it so fatal? I mean, for a common person, the symptoms are just cold and flu. What makes it so fatal that it's claimed over 160 lives this time?
So this is a very difficult question, because most of the time we see people who are at high risk. They are the person who gets maximum impact of this disease. But we do see some healthy people who also get severe disease, and many a times we are not able to save these patients. But the most important role somehow is played by the virulence of the virus, as well as your own immune status and the underlying body condition that makes it more serious in some patient and just a flu in some people, you know.
Let me just take this further apart from the national capital, where we've seen many cases but no deaths so far, fortunately. Over to Rajasthan, which has seen the highest number of deaths this time. People are criticizing that it is the lack of surveillance, the lack of proper systems in place to actually test for this virus.
So testing is not that important if you talk about stage 1, the group 1 and group A disease. It is important in group 3 diseases. But yes, we do know that this virus changes every 3 to 4 years and its virulence increases every 3 to 4 years. It is the nature of the virus that causes more severe disease in some years and less severe disease in other years. But definitely we should always take precaution, because every year we see so many cases of H1N1 and swine flu in our country. So precaution should always be taken beforehand once we start seeing these patients on a rise.
Right. You know, interestingly, the debate over health and in the winter season in India recently, perhaps in the last 5 or 6 years, has moved over to infectious diseases. Do you think India is ready, all the systems are in place to tackle infectious diseases like dengue, chikungunya, swine flu? These are new names that have come up in the last 5 or 6 years.
Yeah, so if we see that our tropical climate is such that we tend to have more of these infections. These are tropical diseases in terms of we have more mosquitoes and more arthropod-borne diseases. And the other diseases that we are talking about, H1N1, tuberculosis, these are all airborne diseases. So somehow hygiene and proper maintenance of our system in terms of, if we talk about dengue, malaria, chikungunya, these are all mosquito-borne diseases. So we have to take proper action to stop the breeding of these mosquitoes, rather than once the disease is there and then take treatment and emergency action for the management of the patient. So this is very important, that our system should be in place and we should be properly prepared before these diseases comes to our, comes to medical attention. So it is very important that we should take preventive measures, because it makes a huge impact in our society in terms of cost, in terms of health loss, in terms of the quality of life, in terms of the losses of days that the patient are not able to go to their workplace and earning. All these things.
Productivity goes down for the entire nation. My final question, when can patients expect this swine flu fever to go down? When can things
So most of the time, every year we see that as the weather improves, as we get towards summer season, this virulence of this virus goes down. So this time also we expect the same thing. But meanwhile, we can take all the proper precautions so that it should not spread further. We have to take all the precautionary measures first, rather than going for the treatment, because you don't know that in which patient this will be fatal. So this is very important, that by the time this will goes down, we should have all the proper precaution in our hand by the public to take all these precautions. That is very important.
Thank you very much, Dr. Sharma, for joining us and giving us insight and important points. So you heard the doctor there. Until the weather gets better, please ensure that you take all the precautions. It's always better to take precautions than be sorry later.